Good afternoon from Bucky and myself on this slightly grey and cold Friday afternoon. So I'm afraid today's not going to be the regular, let's go outside to the canal and learn some English with Heather because, I can't walk at the moment, so that's impossible. So we're going to do a little fireside chat like Franklin Delano Roosevelt did. And with the weather forecast, I think I'm probably in the best place to be right now. So, as you know, some of you may know, I had surgery a few weeks ago on my ankle because about 18 months ago, I fell in a hole while walking my dog and twisted my ankle really badly. And then there was a series of, misevents that meant I didn't get treated properly, I didn't get diagnosed properly, and I did it again a few times. And in the end, I completely destroyed my ligament. So I went to see my orthopedic surgeon and he said, Mrs. Cazotte, we have to do an operation and fix this. So I had surgery. So I'm going to talk to you about some medical terminology and vocabulary for speaking about surgery or going to a hospital. So I had this done in a day clinic or walk-in surgery, which means that I went in the morning and I came out later that day. Well, I didn't actually go in the morning, I went in at 2 o'clock. Which was especially practical for the fasting part. Now, fasting means I wasn't allowed to eat. And so I couldn't eat from 8 o'clock in the morning or 6 o'clock in the morning until 2 o'clock. That was very hard. But the hardest part was I couldn't take my telephone because you're not allowed to take your phone into this walk-in clinic. And that was really tough. Living a whole afternoon without my phone, dramatic stuff. I also had to have some blood tests before I went in, a prise de sang. Anyway, when you get to the hospital, you go to admissions and then they send you off and they give you one of those lovely, attractive gowns, which are now disposable. You can just throw them away. But they give you like a little dressing gown thing, so that's quite nice because nobody likes hospital gowns. And then you go into pre-op where they give you a drip. They put a drip in your arm. A drip is a perfusion, so they can give you medicine and things like that. And they also take your blood pressure. When they put that thing on your arm that gets tight and it checks your tension or your blood pressure. And then I had my surgery. So they wheel you in to theatre. That's right. We call it operating theatre or theatre, going into theatre. It's quite funny, really. I suppose it is quite a dramatic place. But in America, they don't call it an operating theatre. They call it the operating room. So much more boring. We're much more, symbolic and using imagery in English. And so I did not have a general anesthetic or a local anesthetic. I had it done under epidural, which means that they just put my whole leg to sleep, but the rest of me was wide awake, which was quite fun, really, because I was aware of everything that was happening around me. And even though you don't feel pain, you can actually feel them, moving your leg around and doing stuff. So it was an enlightening experience. When they'd finished performing surgery, when the surgeon had finished, he stitched me up and then they put on a dressing, a big plaster and things. And then they put on my walking boot or my orthopedic boot, which means I can't put my foot down because I'm not allowed to weight bear on this leg for 5 or 7 weeks. And then they put me in the recovery room where they check your blood pressure again and check your saturation levels, how much oxygen is in your blood, and then they send you home. They sent me home with, as I said, a pair of crutches to walk with, but I'm not very good at that. And I have a nurse who comes every day to give me injections, and I really hate injections. And she also comes to check the dressing on my scar or my wound. So I had a very nice orthopedic surgeon. His name is Dr. Dupuis, and he has the best bedside manner. So bedside manner means the way that a doctor talks to his patients or the relationship he has with his patients. It's if they're kind and understanding and sympathetic. And remember, sympathetic is not the same as in French. It means that he understands my pain and, all my little slightly hypochondriac side. But I have been back to the clinic twice since I had surgery. Once because I fell over on the crutches, and another time because I had a problem with the scar. So I went back to A&E, that's accident and emergency, and that's what they say in British English, but in American English they call it ER or the emergency room. And it's not a place that I really like to go. Anyway, so in a few weeks' time, I'm going to go back for a post-operative appointment, see my doctor, and then they're going to take off this boot and give me a brace on my foot, and I'm going to see the physiotherapist, or the kiné, as you say in French. And I hope then I will be back on my feet, walking my dog and running along the canal. And most importantly, back in front of you, my dearest beloved students. Anyway, have a good weekend and fingers crossed for some snow.